Hello, participants. Vidhya Venugopal from India, and we have been working in this space for the last 20 years. And what we see in our research and our lived experiences is what I'm planning to present today. And we all need evidence because, like, heat does impact people, especially the workers. And we do see that there is an increased Earth's temperature by 1.2 degree. And while we do this research, this is what our justification is for. It increases heat and leads to heat dehydration, heat stress. Not only that, but other health problems, especially among people who are exerting outside or in heat. So by projections for 2030, India, it is estimated that India will be losing about 34 million jobs. It's not 34 million jobs, it's 34 million jobs, equivalent hours will be lost because of heat. And World Health Organization and ILO, UCA will agree. The productivity loss will be about 2.4 trillion by 2030. And it's something that we just lose because heat is not there, which could be used for something very productive for the humanity. And ILO also has reported that about 1.6% of the total working hours are lost annually due to heat stress globally. See, one of the things that we see, like, what is the future stress or heat stress for India? You can see on the left side, the picture. India is going to have heat across the board. Now we have some parts which are moderate, but now it's in by 2050, 60, it's going to increase more and more. Not only that, across the world, you see wherever you're seeing the orange spots, these are all places where people have researchers have reported heat stress and health issues. So it is all about the supply and demand. Like, wherever there is a problem, people start researching on it, and you can see it's across the board. This is just a snapshot of what we see. Many sites have not even reported anything, but probably their papers are not published or the reports are not out in the online versions, right? Why we think it's very important for, especially for heat workers and workers, is climate change is increasing the frequency, intensity, and duration of the heat waves, straining vulnerable population. And vulnerable population here, I mean the workers. And heat stress poses as major challenge for occupational health and safety as well. I will explain why it's for health and the safety as well. And work is essential for the livelihood of these workers. Exposure is unavoidable to heat, which directly impacts their health, their productivity, their safety, and even their future health. Workers are exerting outdoor and non-air conditioned spaces with lack of ventilation and face the brunt of these rising temperatures. And here we are less worried about people who are indoors like me under the air condition, but about the blue collar workers who are out there and whose livelihood depends on working. Right? This is the evidence that we have from our own studies, is that the WBGT is about 38 to 46 with a 40 to 80% humidity. This is from southern India and some of central and west India. 91% of the workers are exposed to heat, and then they have reported heat-related illnesses. For a person who is exerting outside with heavy workload, the WBGT safe levels is 27.5, and we are looking at 38 to 46. So it's quite high. For example, in 2024, 37 cities in India exceeded 45 degrees centigrade, and 670 billion workers were exposed to heat, many in life-threatening conditions. That is just in 2024. And the temperatures are going to increase. This is the very common scenario that we see, a very conservative scenario, the future climate change. By 2080, the temperatures are going to be really bad when it comes to India. And heat stress is very common in tropical settings. This is just not an Indian scenario. I've taken pictures from India, but this is a very common scenario in any low and middle income country. Most of the work is like very manual. For example, if it's a rice field or a stone quarry or a brick manufacturing, sugarcane cutting in Nicaragua, or a steel worker or a salt pan worker, construction worker in Qatar. These are all very exerting jobs, and most of it is very manual. Automation is also very limited. 81% of India's workforce is employed in the informal sector, where less protection for insurance and other things are available. And occupational health services are also very poor. 50% of the workers contribute to India's national income. So we are dependent on these informal sectors for our GDPs. Physical work remains very high. Poor cooling, minimal automation, and welfare provisions are also pretty poor. There is also a rising kidney disease reported in mining and agricultural communities, just not here in Sri Lanka, in India, in Indonesia, in Nicaragua, in Central America too. And heat stress, let's give a small overview for people who do not know much about heat stress. When you speak about heat stress, it's a combined heat load that is imposed on the worker from the environmental exposures that you have, plus your metabolic heat, means the heat that is generated inside your body, plus the clothing that you're wearing. So these are the things that actually imposes the heat on the body. That is called heat stress. When a worker is actually working, there is solar radiation, radiation from the processes. If he is working indoors and it's from a steel work or a commercial kitchen, there is also process generated. He doesn't have to be always outside. Air temperature, air humidity, and the wind, plus the metabolic workload. This is something called a WBGT, word bulb globe temperature, which is an index that is developed to model the heat stress imposed on the worker. And it also takes into account all those things plus the clothing and the workload. What happens is like your internal core body temperature starts to rise because there is a heat strain that happens in the body. Because of the heat exposure from environmental temperature, and metabolic, and the clothing, internal body temperature starts to rise. And the heat gain happens from all these sources that we spoke about. We also lose heat from the body by sweating, by radiated conductive and convective heat. But if the thermal balance between the heat loss and the heat gain is not proper, and the heat gain is more than the heat loss, then there is something called a heat strain that happens in the body. And just a simple example as to how the heat exposure happens, what happens inside the body, you uptake it, and then there are some physiological strain responses, like increase in core body temperature, increase in your sweat rates, increase in your dehydration, specific gravity, urine specific gravity increase. These are changes that happen inside your body. These are called strain responses. Then, if you do not stop there, then it goes into a range of heat-related illnesses. And heat-related illness, heat stroke does not happen right away. It stops with mild symptoms, then it goes to cramps, then it goes to syncope, and then finally, so there is actually a continuum. It's a continuum. So there is an opportunity for us to prevent at a mild symptom level or at a syncope level before it actually progresses to heat stroke. Heat stress actually has a systemic impact. It's just not only your heat-related illnesses. It impacts your central nervous system. It impacts your cardiovascular system. It impacts your respiratory system, reproductive system, renal system, and also musculoskeletal system. There is because of the lack of cognition in your central nervous system, you have accidents and reduced cognition, slip, trip, fall injury can happen. So the safety component also comes in. Because of your rapid heart rate, because of the heat strain, your cardiovascular system is strained. Your respiratory system, you start to breathe heavier and heavier, and then you intake lot of air pollution, and which you normally would not, which versus your COPD. So it has a major impact on almost all the system. See, thermoregulatory system is the basis of life. If you have 3 degrees higher, you're in a state of fever and in a state of heat stroke. When you have 3 degrees or 4 degrees less, means you're almost dead, right? So thermoregulatory system affects everything. It just goes beyond health. So it's not only about health when it comes to heat. It has direct impacts, which is your heat-related illnesses, kidney injury and everything. But you also have other indirect impacts. You have mental stress, you have reduced cognition, you have productivity losses, you have increased medical expenses, you're forced to migrate because of heat. People are not able to work in heat. And climate change is also making changes in the way that people can work or cannot work. And also, you have a poor social life because of that. Apart from the physiological impacts, you have your social impacts, economic impacts, and psychological impacts too. So, this affects all phases of your life, which the social, economic, and say, psychological impacts also impacts your behavior, how you change and adapt to the heat. So let me give you some examples of what we actually see. For example, we did some studies. I'm going to give you an example of one indoor environment, one outdoor environment for now, and then we will go on. For example, because there is always this myth for people to think, oh, heat affects only people who are exposed to sun. Not necessarily. There are like process generated heat that comes from these places. So we did a study with the cashew nut workers who are working indoors processing cashew nuts. We did the study in Tamil Nadu in 5 workplaces between 2021. We found that 65% of the workers were exposed to above safe limits. We had 56 male workers and 44 female workers who were exposed to above temperatures. We did some blood analysis and we found that 27% of them had dry mouth, dry throat, and excessive. 95% of these workers were affected by many of these heat-related illnesses, and the heat strain was found in 37% of these workers. When we did the blood analysis, we found the serum creatinine before and afterward. We found 14% of them had reduced kidney function. See, one of the interesting things that we found is these working population was between the age of 27 to let us say 40. And they have 14% reduced kidney injury. With age, anyway, your kidney function goes down. And then these people continue working in this heat, then their kidney function further goes down and it becomes a disability for them and they won't be able to come to work at all. And that's something that we see in many sectors in India. See, one of the things that we also saw in heat salt pan workers. Same kidney. I'm just taking one. We are doing multidimensional heat and mental health research, but I'm just presenting you something on one space because of the time constraints. So when it comes to renal health, for outdoor workers, we did a cross-sectional studies across 7 salt pans in India. Workers were between the age of 18 to 85, 352 workers. Heavy manual work we saw. And then 85% of them were manually working. Then 87.5% of them were exposed to above TLVs. 93% heat strain, 59% dry mouth, throat, and urogenital issues were seen in 77% of these workers. Environmental conditions, they work both during summer and winter. Both the times, we saw that 95% of these locations were above the WBGTs. And reduced kidney function, 56% were in men and 38% in women. We found the risk was higher in male workers because of higher exertion and high heavy workload for them. They had 1.7 times higher risk of lower EGFR, less than 90, and then 3.1 times risk of EGFR less than 60 mil, because when you say EGFR less than 60 mil per minute per 1.7 means they are in the stage middle stage of their kidney disease. And if it further declines, then they get into actually something called chronic kidney disease. And that disables them. They have to go for dialysis and they won't be able to come forward. Another important group that I want to also share is the migrant workers. We have done a study comparing outdoor workers and migrant workers because both of them are working outdoors. But who is more vulnerable when it comes to heat? It's the migrant workers. And then because of the climate change consequences, one thing is they are migrating. They work mostly in agriculture and construction, a lot of them. They have problems. There are other core risks for these workers. For example, cultural aspects are there. It could be religious, it could be linguistic, there could be adaptation, or where they live. They live in temporary shelters. which is not like, the building envelope is not very good. So a lot of people are suffering because of this, including those people who are working in Qatar and other Middle Eastern countries where the exposure to heat is very high, and they do not have time to repair their own heat during night times because of extra working, extra long hours. We found that 1 billion people are employed in agriculture and another 66 million in textile industry alone. These are all migrant workers. So you can see the sheer number of people impacted by heat when it comes to this migrant workers who are most vulnerable, right? So heat deaths in India, we can see that it's increasing, and this is just under reported here. And many people were in Odisha or in 7 lakh deaths in India due to abnormal temperature. So many of them are migrant workers, and it becomes even worse for migrant women workers because many of these workplaces do not have toilets, and there is an increased risk of 1.7 times increased risk of urogenital issues for these women. Many of these women get into interpersonal issues with the supervisors and other things, and he does that to them, to people. It is a normal physiological response that irritation and everything happens because of heat. And all of this is compounded. We work with about 433 migrant women, and limited access to medical facilities, no access to drinking water or poor sanitation, lack of access to toilets. They're not covered by government schemes because they don't have proper identity cards, no access to menstrual hygiene at their workplaces, no proper sanitary disposal. So many of them, the most easiest and most feasible thing that heat mitigation can be done is by hydrating yourself. And many of these women do not hydrate themselves properly because of lack of access to sanitation and toilet facilities. So we found like major issues for these pregnant women, for these migrant women, especially for pregnant women who are migrants also. So what we saw from our studies, what we found was like double the time of risk for these heat exposed women. One is there is a competition that happens inside your body, whether the blood should go to the extremities to cool yourself or should it go to the fetus. Correct? So usually when the body temperature is increased by 1.5 to 2.5 temperatures when a woman is pregnant, and then she has this heat exposures and this workload and everything. So this can lead to to her own health problems, also a risk of poor birth outcomes like stillbirth, preterm birth, neurological problems for the child, low birth weight, birth defects for the child. So what we also found was like, in the first and second trimester, there was also 2 times higher risk of spontaneous abortion. And all of this data has been already published. So this was also covered by the British Broadcasting Corporation in the World News. And my research scholar who was collecting data and working with these pregnant women, miscarriages happening, premature birth, low birth weight, it was covered worldwide. And we also found it's just not only the health related issues, also basic lifestyle. For example, heat related sleep quality. There is difficulty sleeping for the people who are exposed to heat, restlessness, non-restorative sleep happens. About 70% of these workers reduce total sleep time. So we are measuring all of this as well. And night sweats, because many of these migrant workers, vulnerable workers, they do not live in air-conditioned facilities. They live under the bridge or wherever the temporary shifts are. So shift workers, older women, people working in steel and petrochemical, the offshore workers, they are all exposed to very, very high heat exposures. And there is a process as to how heat disrupts sleep, and it's a science behind it. This also has been published. So we are trying to now work on what kind of interventions we can give for these people. Problems are always there. What kind of interventions we can give? So something that is feasible, that is sustainable in a low and middle income country is what we are thinking. For example, water, rest and shade. Earlier also we had speakers from Central America and US coming and speaking about it. So we are just presenting evidence from our study. One of the things that we see is the control group workers whom we do not give intervention. We find the renal impairment 2.83 times higher, means there is less risk for people for whom we are actually giving interventions. And these are all very, very simple, cheap interventions that can be deployed in any workplace, outdoor workplace. And the intervention group was protected by 87% of them had less issues with heat, reduction in heart rate, reduction in urine specific gravity. So it is a win-win situation when it actually, and people were very comfortable. 75% of them were felt very, very comfortable following this intervention, plus also health wise. And there is also this perception that they are not very heat stressed, and they found very comfortable working with this kind of interventions. Cool invest interventions. So we have to do something for the indoor workers as well. What could be done? Something like as simple, something that's available in Amazon, or we can ask a local tailor to make these as well with some plastic vests. We can add some phase change material or even ice. That's what we did. We used both phase change material and ice, and we actually measured for the intervention group and the control group within commercial kitchens where the heat exposure is very, very high. We found, and 80% of these workers were said that it is very comfortable for them to wear, and that their abdomen and was very much protected by the from the heat because of this wearing these cool vest interventions. Apart from that, we are also thinking about traditional body cooling food intervention that's happening. We are working with workers in the primary healthcare centers, people, because that is where these poor workers will frequent. And we are working with informal workers who work from home. What kind of cooling foods can they have during these summer? We do educational interventions, we do the pamphlets, we do posters in local languages, and educational awareness. And then we also give them food diaries, what they have done, how much they have, the fidelity and everything we do. And we found that there is an 83% improvement and interest in heat educational awareness. And we also found the usage of these locally available cheap food interventions were very useful to these poor people. Heat and sleep disturbance happens, like I have already spoken to you about it. So we are looking for interventions for that also. One of the things that we are also doing is sleep and yoga. Something that can be done in a workplace. A few minutes, 3 to 4 minutes of yoga that these people can do, and then some deep breathing, just sitting down wherever they are, not anything very difficult for these people. And we are also training them on giving them some capacity building on what kind of yoga they can actually do before they go to sleep, so to improve their sleep. If the sleep improves, automatically the cognition improves. And we also found core body reduction in intervention group at least by 0.3 to 0.5. We found that at least there was an increase by decrease by means your core body temperature goes down when you're doing this yoga. And we found improved sleep quality, nighttime waking, slow wave sleep, perceived heat stress also kind of reduced, and the workers felt much better. Very simple. And before you go to sleep, do the shavasana and viloma too, and then you will feel your sleep quality increases. This is something that we are doing, which is no government intervention is needed, no NGO has to come. Directly we can simplify, make it into videos, send. When people have phone, every single Indian now has a phone. So is there something that we can do to those people, which is cheap, which is sustainable, which is also feasible? Apart from that, we are also doing proactive heat protection for these workers. We are working with big industries like the construction companies, the salt pans, the mining and everything. And what can we do for, we are giving them we are encouraging regular health checkups, first aid readiness in remote working places. And we are also telling employers should be accountable. Employers should be accountable. Some of the CSR could be spent on improving the workers' living conditions or their welfare conditions. Okay, and with the protect workers are protected and they become very resilient to heat-related illnesses as well. Heat is definitely hazardous, especially in tropical countries. So lots and lots of worker awareness campaigns we do. We go and speak to the workers who work in different industries, and we teach them about how we can actually find ways to keep themselves cool in very simple manner, not depending on the government or depending on the employer. At an individual level, we are teaching them how to protect themselves. And we continue doing this work. This is summer right now, and the whole team is out in the heat space, working with workers, trying to collect data, disseminate heat health protection information, working with governments, working with the primary healthcare centers in trying to make sure these workers are safe and they learn how to protect themselves. Thank you very, very much.